I would have to say that skills and training are really key. Interpersonal skills are particularly important because of the vulnerability that patients feel. And yeah, it's you feel very fragile. Not all the time, but there are periods where, you know, where I was feeling unwell, that I felt quite fragile. So I think an appreciation of where patients are at. The other thing that I think is really important for teams to understand is the impact, the emotional impact, so the vulnerability, but there's also a loss of self-esteem. So, you know, I know in my own circumstances, I felt that my self-esteem had really taken a bashing with my illness and diagnosis. I felt like I didn't know who I was anymore. I was always a strong, outspoken woman, and my cancer kind of took some of that away from me. So being at team meetings, you know, I think researchers need to be aware that patients may be feeling vulnerable, may be suffering with a loss of self-esteem, and really need to, you know, if somebody's quiet or not contributing, to check in with them and see, you know, what they're thinking, what they're feeling, what input they have. Following up after meetings, I think, is very important as well. Because I think because of that vulnerability, you know, and because of the information that is sometimes discussed in a research environment, like, you know, I think of clinical trials, teams where patients are included, and you know, they might be hearing information that's unsettling, and so I think it's very important for teams to, you know, the team lead to check in and see how they're doing.